What if your power goes out tonight, your phone dies, and someone you love is bleeding, but you don't have what you need to save them? Sounds extreme? FEMA says it's not only possible, it's likely. Every year, thousands of families face sudden disasters unprepared, not because they didn't care, but because they didn't know what was missing from their first aid kits. In this video, we're revealing 12 critical first aid supplies FEMA says you must keep at home before the next disaster strikes. We're not just talking about Band-Aids and aspirin. Some of these items are rarely discussed, easily forgotten, and could mean the difference between life and death when emergency services are delayed. You'll learn what supplies even doctors keep in their emergency kits, why FEMA insists on items most homes still don't have, and how to pack your kit the smart way, without wasting money. Stick with us till the end, because we'll uncover the number one most overlooked item that even seasoned preppers forget, and why it could be the first thing you reach for when disaster hits. Welcome to the channel, your guide to staying prepared, protected, and powerful when it matters most. If you find value here, don't forget to hit that subscribe button, give this video a thumbs up, and share it with someone who needs to hear this today. 1. Sterile adhesive bandages. Before we talk about the bigger emergencies, like fractures, burns, or allergic reactions, let's start with something surprisingly dangerous: small cuts. Yes, even tiny wounds can become life-threatening if not treated properly, especially during disasters when hospitals are overwhelmed and clean water is scarce. Sterile adhesive bandages are your first line of defense. They might seem basic, but without them, bacteria can enter the body quickly through open skin. In flood zones or after earthquakes, infections spread fast, and many people don't realize that a small cut on a finger can turn into a serious issue within 48 hours if left exposed. That's why FEMA stresses the need for assorted sizes. A large bandage on a paper cut doesn't seal properly, a tiny strip won't protect a scraped knee. You need options: small, medium, large, fingertip-shaped, and even knuckle-specific bandages. Each shape is designed to cover a wound securely and stay in place even when you're sweating, moving, or sleeping. Many people keep only a few bandages at home, usually tucked in a bathroom drawer, old, discolored, and no longer sterile. In an emergency, those won't help. You'll want an airtight, waterproof container with fresh, sealed bandages in different sizes. Also, don't forget hypoallergenic options. Some people are allergic to latex adhesives and don't find out until it's too late. Imagine having a skin reaction during a crisis because of the bandage that was supposed to protect you. And here's something few people know: sterile adhesive bandages are also useful for sealing blisters, covering broken nails, or protecting an injection site after giving medicine, like insulin or an EpiPen. Having the right bandage in the right moment isn't just about comfort. It can stop infection in its tracks, preserve skin integrity, and buy time when professional care isn't available. 2. Gauze pads and roller bandages. When things turn serious, when there's blood pooling, not just dripping, adhesive bandages won't cut it. That's when gauze pads and roller bandages become essential. Imagine someone gets a deep cut from broken glass during a storm, or a puncture wound while clearing debris after an earthquake. Blood starts flowing fast. You panic, but if you have sterile gauze pads on hand, you're in control. These thick, absorbent pads are designed to soak up blood and stop bleeding, buying you precious time. FEMA strongly recommends including multiple pads of different sizes. Smaller wounds need 2x2s or 3x3s, but for gashes or heavy bleeding, 4x4s are the standard, and just placing a pad isn't enough. You need to wrap it tight to apply pressure. That's where roller bandages come in. They hold the gauze in place and apply steady compression, which slows bleeding and helps blood clot. Too many people overlook the need for multiple layers. A single gauze pad won't absorb much. You may need to stack 2 or 3, wrap securely, and elevate the injured limb to prevent shock. Roller bandages aren't just for bleeding, they're also used to secure sprained joints, hold ice packs, or keep a splint in place. They can even double as slings in a pinch. Another often forgotten detail: your gauze and bandages should be non-stick and individually wrapped to keep them sterile. Reaching for dusty, loose materials in an emergency isn't just ineffective, it can actually worsen the injury. Having gauze and bandages ready isn't just about treating wounds. It's about staying calm in the chaos. It's about keeping blood where it belongs, avoiding infection, and holding things together, literally, until help arrives. 3. Antiseptic wipes or solution. Before you ever cover a wound, before you wrap it, bandage it, or even apply pressure, you have to clean it. And in a disaster, clean water might not be available. That's where antiseptic wipes or solution come in. It might seem like a small detail, but this step can mean the difference between healing and infection. Dirt, bacteria, even floodwater can enter the body through an open cut within seconds. Left untreated, that small wound could lead to cellulitis, abscesses, or even sepsis, a dangerous body-wide infection that can be fatal.
FEMA and emergency responders always highlight this. Cleaning the wound properly is just as critical as stopping the bleeding. Antiseptic wipes are compact, easy to carry, and already saturated with disinfecting agents like benzalkonium chloride or isopropyl alcohol. They're made to kill bacteria on contact and dry fast, no rinsing required. That's exactly what you need when running water isn't an option.
For larger or deeper wounds, antiseptic solutions like hydrogen peroxide or povidone iodine betadine are recommended. But be careful. Some solutions can damage healthy tissue if overused. That's why wipes are often safer for quick surface-level cleaning. Most households don't have enough of them. Some rely on expired bottles or random alcohol swabs. But in an emergency, having a dedicated supply of antiseptic products is crucial, and so is knowing not to skip this step. Don't forget, cleaning the wound also lets you see the damage clearly. Blood, dirt, or debris can hide deeper injuries. Once it's clean, you can decide if the cut needs gauze, pressure, or even stitches. In crisis situations, you won't have a second chance to clean a wound right. One wipe, used at the right time, can prevent days of suffering or even a life-threatening infection. 4. Tweezers plus scissors. Not every injury is about bleeding. Sometimes the real danger is what's inside the wound. Tiny pieces of glass, wood splinters, dirt, or metal can easily get lodged under the skin during disasters, especially after storms, earthquakes, or accidents in chaotic environments. That's why FEMA urges families to keep a good pair of tweezers in their first aid kit. Before you bandage anything, you may need to get foreign objects out, and using your fingers is not only painful, it's risky. You can push debris deeper or introduce even more bacteria. High-quality, pointed-tip tweezers let you remove slivers precisely and with minimal damage. They're small, but they do a big job, especially when access to medical help is delayed or cut off completely. Right next to the tweezers, you'll want a pair of medical scissors, preferably the kind with a blunt tip, often called trauma shears. These aren't regular household scissors. They're built to cut through gauze, bandages, clothing, even seatbelts without poking or cutting the skin underneath. In a real emergency, you won't have time to untie knots or neatly remove clothing. You might need to expose a wound fast, cut away soaked bandages, or trim gauze to size. Scissors are what keep you moving quickly, safely, and efficiently. And here's something people forget. Both tools should be sterilized or disinfected before and after use. Keep alcohol wipes or solution nearby just for that. Without tweezers and scissors, even the best stocked kit falls short. These tools don't just support first aid, they enable it. They're your hands when yours aren't enough, your control when chaos hits, and sometimes the difference between a clean wound and a trip to the ER. 5. Pain relievers, antacids, and anti-diarrheal medications. When disaster strikes, it's not just injuries that you have to worry about. Stress, contaminated food, dirty water, and lack of sleep can all trigger internal issues. Pain, nausea, acid reflux, and even sudden diarrhea. That's why FEMA advises keeping a variety of over-the-counter medications in your emergency kit. Start with pain relievers like ibuprofen or acetaminophen. These aren't just for headaches. In an emergency, they can help manage fever, reduce inflammation from injuries, and ease muscle strains from heavy lifting or walking long distances. A sprain might not seem serious, but without pain control, it can quickly become debilitating. Then there's the stomach trouble no one likes to talk about. After a disaster, clean drinking water and safe food are often hard to come by. You might eat something questionable out of desperation, and the consequences can hit fast. That's why you need antacids to calm acid reflux or heartburn, especially when you're relying on canned or packaged foods that are high in sodium and preservatives. And antidiarrheal medications like loperamide, Imodium, are a must. Diarrhea might sound minor, but in survival situations, it can dehydrate you quickly, leading to weakness, confusion, or worse, especially without medical care nearby. Most people only think of trauma supplies for first aid, but your body under stress needs help on the inside too. Infections, inflammation, or even just panic can cause symptoms that rob you of energy and clarity right when you need them most. Keep these meds sealed, dry, and clearly labeled. And if anyone in your home has allergies or chronic conditions, include what they may need too. A few tablets might be the only thing standing between you and complete breakdown in a high-stress, high-stakes moment. 6. Latex or nitrile gloves. Before you touch a wound, before you clean blood, and before you assist someone in pain, you need protection for your hands. In emergency settings, your own hands can become a silent danger. They carry bacteria, viruses, and whatever was on the surface you just touched. That's why FEMA insists that every first aid kit must include latex or nitrile gloves. These gloves aren't optional. They're a barrier. When you're dealing with open wounds, bodily fluids, or contaminated environments, Gloves protect both the victim and the responder. They stop bloodborne pathogens from spreading. They reduce the risk of infections, especially when water and soap aren't available. And they help you stay focused on care, not contamination. But here's what most people miss. You can't rely on just one pair. Gloves rip, they get dirty fast. You need several pairs, individually packed, preferably in different sizes for different users, and you need to change them between patients if more than one person is injured. Another thing to consider is latex allergies. Many people don't even know they're allergic until they have a reaction. That's why nitrile gloves are often a safer choice. They're durable, stretch well, and don't trigger allergic responses. These gloves are useful beyond first aid too, handling food, cleaning debris, or managing personal hygiene during an outage or evacuation. Gloves will help prevent illness from spreading in close quarters. Imagine treating a child's bleeding arm after a storm, then rushing to care for an elderly parent who fell. Without gloves, you could spread infection from one to the other without realizing it. Clean hands are good. Gloved hands save lives. 7. CPR mask or face shield. In the chaos of a disaster, when someone collapses and stops breathing, instinct kicks in. You drop to your knees. You prepare to give CPR. But there's one problem. Mouth to mouth without protection can be dangerous. Not just for them, but for you. That's exactly why FEMA recommends adding a CPR mask or face shield to every first aid kit. These compact foldable tools create a barrier between your mouth and the patient's, reducing the risk of transmitting infections, especially bloodborne viruses or respiratory illnesses. In moments of panic, people often forget the real risks that come with direct contact. But when help is minutes or even hours away, you may be the only one who can act. A CPR mask usually comes with a one-way valve. That valve allows air to pass into the patient, but blocks fluids like vomit or saliva from coming back toward you. It keeps things cleaner, safer, and far more effective than trying to improvise. Some shields are as small as a credit card and can fit on a keychain or inside a wallet, but despite their size, they offer serious protection, especially when administering CPR to strangers, children, or even elderly family members during a crisis. Most people never think to include this. They focus on bandages, ice packs, and pain relievers, but cardiac arrest is one of the most common emergencies during disasters, especially in high-stress situations like evacuations or extreme heat. Having a CPR mask isn't about expecting the worst, it's about being ready to respond safely if it ever happens. Because in a real emergency, you won't have time to think, you'll just act, and that tiny plastic shield might be the only thing standing between a brave rescue and a dangerous mistake. 8. Thermometer. To detect fever early. Sometimes the most dangerous symptoms aren't visible at all. No bleeding, no bruising, just a pale face, tired eyes, and rising body heat. In those moments, a thermometer becomes one of your most important tools. And FEMA says every home should have one in their emergency kit. Fevers often signal infection, inflammation, or illness, and during a disaster, they can escalate quickly. Contaminated water, spoiled food, or untreated wounds can all lead to bacterial or viral infections. And when you're cut off from hospitals or doctors, knowing whether someone has a low-grade fever or a dangerous spike could mean the difference between waiting it out or seeking help immediately. A digital thermometer is the best option, fast, accurate, and easy to use, even for children or the elderly. Avoid old mercury thermometers. They're fragile and hazardous if broken. Today's thermometers are compact, battery-powered, and often give a reading in under 10 seconds. Most people assume fevers will be obvious, but symptoms like chills, weakness, or sweating can be caused by many things: panic, dehydration, or heat exposure. A thermometer removes the guesswork. It gives you the numbers you need to make smart decisions under pressure, and it's not just for the sick. Monitoring the health of vulnerable people, infants, seniors, or anyone with a chronic condition, is crucial after a disaster. A sudden fever could point to something far more serious, like sepsis or heat stroke, and you won't know without a proper reading. Keep extra batteries with your kit, store the thermometer in a waterproof bag, and clean it with alcohol after each use. In an emergency, time matters. Knowing someone's temperature in seconds lets you act quickly before symptoms spiral out of control. 9. Splint or triangle bandage. Not all injuries bleed. Some leave you unable to move, stand, or even walk because of a twisted ankle, a dislocated joint, or a broken bone. In those moments, you won't need gauze, you'll need support. That's where a splint or triangle bandage comes in. FEMA includes these items because in a crisis, emergency help might take hours or never come at all, and during that wait, movement makes injuries worse. A splint keeps limbs immobilized. A triangle bandage becomes a sling. Together they buy time, reduce pain, and prevent further damage until medical help is available. A triangle bandage is one of the most versatile first aid tools. Folded, it becomes a pressure pad. Rolled, it's a wrap. Spread out, it transforms into a sling for an injured arm or shoulder. It can even be used to bind a splint in place using sticks, boards, or rolled up newspapers if no rigid support is available. A store-bought splint, like an aluminum padded one, is lightweight, reusable, and can be shaped to fit around fingers, wrists, or legs, but even a simple foam or cardboard version can make a huge difference when someone's in pain and needs support. These tools are especially critical for elderly family members, kids, or anyone prone to falls. After an earthquake, flood, or fire evacuation, sprains and breaks happen more often than you'd think. Slippery stairs, loose rubble, or just running in panic. Most first aid kits skip this, but bones and joints can't wait. Without proper stabilization, an injury could turn permanent or lead to shock and further complications. In emergencies, the right support isn't just emotional, it's physical, and it starts with a splint and a bandage that knows how to hold things together. 10. Activated charcoal or syrup of ipecac. There's a silent threat most families don't prepare for, accidental poisoning, and it can happen fast. A child swallows medicine. Someone drinks contaminated water. You open a can of food that smells off, but you eat it anyway, because supplies are low. That's when activated charcoal or syrup of ipecac might be the only line of defense. FEMA includes these items with one clear warning: only use them when directed by a medical professional or poison control, but when they're needed, they can be lifesavers. Activated charcoal works by binding to toxins in the stomach and preventing them from being absorbed into the bloodstream. It's fast-acting and can reduce the severity of poisoning from certain medications, chemicals, or spoiled food if taken soon after exposure. Syrup of ipecac, on the other hand, was once common in homes, used to induce vomiting, but in recent years, it's been largely phased out due to misuse and risk. However, in extreme survival situations, and only under guidance, it may still have a place in an emergency kit, especially when professional help is far away. The key here isn't just having these items, it's knowing when and how to use them. Include a card in your kit with the poison control emergency number written clearly. If a poisoning occurs, call first, act second. Also, keep in mind, not all poisons should be vomited up. Some can burn the throat or cause worse damage coming back up. That's why activated charcoal is preferred. It's safer, less invasive, and highly effective against a wide range of toxins. Few people think of poisoning when building a first aid kit, but in survival scenarios, it can happen in the blink of an eye. And when it does, reaction time matters, and so does what you have on hand. 11. Whistle. To signal for help when voice isn't enough. Imagine being trapped under debris, stuck in a dark basement, or stranded in a flooded area with no cell service. You try yelling for help, but your voice grows weak, your throat dries out, and no one hears you. That's exactly why FEMA recommends something so simple, yet so powerful: a whistle. In survival situations, noise is your lifeline, but your voice fades. A whistle doesn't. It carries farther, louder, and with less effort, even when you're injured, exhausted, or panicked. This tiny tool is often overlooked. Most people fill their kits with medications and bandages, but forget about signaling, especially when power is out, phones are dead, and you're cut off from help. A whistle can pierce through noise, wind, and walls. Rescuers are trained to listen for patterns, like 3 short blasts, an internationally recognized distress signal. It's not just for you either. A whistle can help you locate family members in a blackout, alert rescuers to your location after a tornado, or scare off animals if you're forced to camp outdoors after evacuation. Plastic whistles are best, lightweight, weather-resistant, and non-corrosive. Keep one attached to your first aid kit, one on your keychain, and even one on a lanyard by your bed. In an emergency, reaching it quickly could be critical. You don't think about using a whistle until the moment your voice gives out and help is still out of reach. It doesn't need batteries, it doesn't break, and when everything else fails, this one small tool might be the only way the outside world knows you're still alive and waiting. Chapter 12. Dust mask. To filter dangerous air after disasters. You survive the explosion. You make it through the earthquake. The fire's out, the storm is past, but the danger isn't over. It's in the air you breathe. That's why FEMA insists on one item many people forget: a dust mask. After any major disaster, fires, building collapses, chemical spills, or even volcanic ash, the air can turn toxic fast. Dust, mold, smoke, insulation fibers, and unknown chemicals get stirred up and hang in the air long after the initial danger is gone. You may not see them, but every breath pulls them deep into your lungs. That's where a dust mask or N95 respirator comes in. These masks filter out harmful particles and give your lungs the protection they need to function when clean air is no longer guaranteed. Think about a wildfire. Even hundreds of miles away, smoke can fill the sky and cause burning eyes, tight chest, and coughing fits. In disaster zones, many people suffer long-term health issues not from the event itself, but from what they inhaled afterward. A simple dust mask can block larger particles, while an N95 mask filters out 95% of airborne particles, including many bacteria and viruses. During the COVID-19 pandemic, they became widely known, but FEMA had been recommending them long before. Masks are lightweight, foldable, and take up almost no space in your kit. Yet, in the aftermath of a disaster, they could make the difference between staying strong or falling sick. Keep one for each member of your household. Store them in sealed bags to keep them clean. And remember, you can't survive what you can't breathe through. Disasters don't just strike, they linger. And long after the noise is gone, the air may still be hiding something deadly. Disasters don't wait, they don't come with a warning. And when they hit, it's not the loudest moments that are most dangerous. It's the ones that follow. Now, you know the 12 critical first aid items FEMA says every household must have before the next emergency. These aren't just supplies, they're lifelines. And yet, most homes still don't have them all. A few adhesive bandages? Maybe. A bottle of expired painkillers? Possibly. But how many of us are truly prepared for the silent threats? Airborne toxins, infections from tiny cuts, the shock of sudden injuries, or the panic of being trapped without a voice? Every item we covered today, from the tiny whistle to the simple thermometer, plays a role in buying time, saving lives, and keeping control when everything else feels out of your hands. This isn't about fear. It's about being ready. It's about thinking ahead, not looking back with regret. So before you close this video, ask yourself, is your first aid kit complete? Are your supplies sterile, packed, and ready? If disaster struck tonight, would you be ready to respond in the first 10 minutes? If not, now's the time to change that. Because when the lights go out, when the sirens stop, and when help is still miles away, you are the first responder. Don't wait for disaster to remind you. Prepare now. If this video helped you feel more prepared, hit that like button, subscribe to Crisis Ready Life, and share this with someone who might be depending on you when things go wrong. Stay alert. Stay prepared. Stay safe.